Hey guys, it's Haley, Cosmetology 120 Lab, and today we are going to do a set of artificial lashes. We are going to start by greeting our client, escorting them to the work area. We are going to assess their current style, determine their preferences, as well as any special needs that they are hoping to get out of the service today. We are going to assess the client's skin by performing a skin analysis to ensure that there's no inflamed, irritated, broken, raised, or swollen skin in the area to be worked on, any open wounds or sores in the area to be worked on, infection or infestation such as lice that would prevent us from safely performing the service today. We are going to assess the client's consultation form. We're going to discuss with them any medications or products they've used within the last 72 hours. Also ask about any known allergies that the client may have. We are going to consult with the client on any facial surgeries they've had within the last 3 months, and if they remain under physician's care for those. We are going to ask if the client is prone to fever blisters or cold sores, and we are going to assess if the client has used exfoliating or lightening agents in the last 72 hours, and that would be your AHAs and your BHAs. And we are going to determine if the client has had any facial injections within the last 3 weeks, such as Botox or hyaluronic fillers that would affect our service today as well. If the client is free from all of those, then we would go ahead and proceed with today's procedure. We are going to start by washing our hands, so wetting our hands under warm running water and lathering with liquid antibacterial soap. Rinsing our hands under warm running water. Drying our hands with a disposable paper towel. Turning off the water with the paper towel and disposing of the paper towel in the trash. Then we are going to sanitize our hands. This is hand sanitizer. It does have to be between 62 and 70% ethyl alcohol, and this particular brand is 70%. And then we are going to put on our gloves and clean our work area. So I have my Barbicide wipe number 1. These are EPA registered, verified, safe for use in the spa and salon setting, and they are verified effective as a bactericidal, virucidal, fungicidal agent. So we are going to clean and sanitize with wipe number 1. So we're wiping down our bed. And we're going to wipe down. This is going to be the little, and it's been sanitized, but my tray I'm going to use here. We're going to wipe down our cart. dispose of that in the trash. And then we have wipe number 2, and this is actually disinfecting our work area. Dispose of that in the trash, and then we're going to remove our gloves. And those are disposed of in the trash. And then we are going to gather the items that we're going to need. So I have this tray that I'm going to use, and I am going to put some cleanser or makeup remover in here. And then I am going to get out a couple of eye rounds. A disposable mascara wand. Gonna get a couple of wooden sticks to apply the glue to the lash. And I have my tiny scissors. Lash glue. And a new set of lashes. I also need a set of tweezers. So there's my tweezers. And I am going to use this as my disposable table cover. And we're going to help the client onto the bed. And we're going to give her a hairnet. And have a towel to drape. Alright, so now we are going to wash our hands again. So wetting our hands under warm running water, lathering with liquid antibacterial soap. Rinsing our hands in warm running water. Drying our hands with a disposable paper towel. Turning off the water with the paper towel and disposing of that in the trash. And then again, we are going to sanitize our hands. first thing we're going to do is cleanse the eyes. We're going to take our disposable mascara wand and we're cleaning client's lashes just to make sure they're good and clean and that there's no residue. And then we would dispose of that. And what we're doing here is just measuring the lash. And these are actually a good fit. If they were too if these lashes were too long, we would trim them with our scissors and we would dispose of the outside piece because we're going to trim it from this outside area. So this piece would be trimmed and removed, and then we would measure it one more time just to make sure that we have a good fit. Yep, that one looks good. Now we're going to double check the other eye as well. And this one looks good as well. So again, if they were too long, we would trim from the outside, what's going to be on the outside of the eye. We would trim from there, and we would remove that and then measure it one more time. And it looks good. And then our scissors would go in our to be disinfected bin. Dispose of this in the trash. I'm going to give this just a second to get tacky. And we are going to talk with our client about maintenance and aftercare. This will go in her to be disinfected. This will go in our to be laundered. And then we're going to we have wipe number 1. This is clean and sanitize. And then we have wipe number 2, which is disinfect. And those are disposed of in the trash. And then we are going to wash our hands again. So washing our hands under warm running water, lathering with liquid antibacterial soap, rinsing our hands in warm running water. Drying our hands with a disposable paper towel. Turning off the water with the paper towel and disposing of that in the trash. And then we are going to sanitize our hands again.